All right, so I'd be here in the medication room. I'd be going over the orders from my patient. So my patient is Anthony Myocard. He has an order for heparin 5,000 units, and 5,000 units is 1 milliliter. So I'd be getting a 1 milliliter syringe for that. It's subcutaneous, so I'd get a 27 gauge needle. And then my other order is for meperidine hydrochloride, which is Demerol. And that is 50 milligrams to 1 milliliter, and I need 100 milligrams, so it'd be 2 milliliters. That I'd get a 22 gauge needle, and then also that is intramuscular. So I'd make a note of that, I'd check that, make sure I have everything correct, I have all the right equipment that I need. I'd go over my 5 rights before I leave the med room, which would be right patient, medication, dose, route, time. I've done that, and then I'd take all of my equipment, and then I'd take that with me as I go into the patient's room. I'd come in and make sure that there's privacy. I'd shut the door, close the curtain, or whatever I had to do to make sure privacy. Hi, my name is Luke. I'm going to be your nurse for the day. I'm just going to be giving some medications, 2 injected medications. So you okay with needles? Mm-hmm. Okay. Can I just get your name first? Seham, can I get your birth date, please?
July 30th, 1998.
Okay. So, and then I'm just going to check, make sure I have at least 2 identifiers. I'm just going to ask you a few questions. How are you feeling?
Good.
Any pain?
Yeah, I have a bit of pain.
A little bit of pain? Well, we have Demerol, so that should help you with your pain.
Yes.
And then, do you know where you're at?
Yes, Bellevue Hospital.
Do you know what day it is?
November 6th.
Good. So, ANO times 4. I got my 2 identifiers. And the last question, do you have any allergies that you know?
Not that I know
I would also probably check that in the MAR, but it's never a bad idea to ask them. Then I'd get my work area. I'd begin to get my work area set. So, Siham, we're just going to I'm going to get my medication set up real quick. I'm going to, after that, once I get all that set up, I'm going to just landmark some of the sites that I'm going to use for intramuscular injections, because that's what your Demerol is going to be. But before that, I'm just going to get everything set up. So give me 1 second. I'm going to raise your bed up just a little bit so that I have a little bit more room to work with. Just tell me if you're comfortable or uncomfortable. And pretty short, so I think that's fine. All right, I'm going to get this.
Okay, so I'm in the medication.
Clean my area before I draw up my meds. Ooh. Oops. Okay. Back. Wipe down my area. Alright, that's good.
And then I'm just going to verify your name.
So, as I'm preparing to draw up my medications, I'm going to recheck the MAR again, make sure I have the right medication, the right amount, that it's the right time to be given, that I have it's for the right patient. I just go over all that again. I recheck it all the MAR. My 5 rights of med admin, patient, right medication, right route, right dose, right time. All of that's good. I have everything right and correct. I'm going to get everything just laid out. So I have heparin, which would be my 1 millimeter and my 27 gauge needle. And then I have a cannula for that, draw cannula, and then 3 millimeter syringe, 20, this is my cannula for drawing, and then 22 gauge needle for intramuscular. Got gauze for afterwards, and then this is my meperidine hydrochloride Demerol. So I'm going to start with, I'm going to get everything prepped for my heparin draw. Make sure all the packages are open. Making sure not to touch the inside of that plunger. Alright, so I need 5,000 units of heparin, which is equal to 1 milliliter. So I'm going to drop a full milliliter. I can get it open, it is. Making sure not to touch this top part. Screw it on. And I'm going to draw up just a little bit more than a milliliter of air. Before I do that, put this back in real quick, just so I don't forget. Since this is already opened, I'm going to wipe it off with a alcohol prep. And then I can get my needle back out. I already have the little bit more than a millimeter of air in, so I'm gonna put that in, get the air inside, and draw up a milliliter of medication. Probably gonna have to redraw because the air bubble was quite large, but that's okay. Yep, I'm gonna have to drop a little bit more. A little bit more than a milliliter again, just to make sure. I can always push the rest out that I don't need if it's just a small amount. Good. I'm gonna scoop up, put this, remove the cannula, and then I'm gonna put on my needle, a 27 gauge needle for subcutaneous administration. And then I'd leave that here, ready to be used. I label this because I'm going to have more than one medication that would be labeled my heparin. Luckily, my heparin is different colors, so it's very easy to tell, but I'd label it in case. This would go in the sharps. It's over there, so I'll do that at the end. Then I'm going to get my, then I'm going to get everything ready for my Demerol. I need 100 milligrams of Demerol, and it comes in 50 milligrams to a milliliter, so I need 2 milliliters. 100 milligrams, I think I said 100 grams. 100 milligrams. Prepped. Alright. Cannula, and then 22 gauge, 1.5 inch needle. Good, good. Alright, try not to touch that plunger. I need this first. I need 2 milliliters. I get a little bit more. I already wiped it off. Oh Lord. That is quite the air bubble. Okay. I'm gonna have to get some more because there's a little bit more air in there than I want. That's fairly normal. Yeah. Good. Make sure, just double check it again. Yep, we're good. It's all the way to the top. I'll do my scoop method. Take off my cannula. I take both of these and just set them over here. These are going to go in the sharps when I'm done. And then, it didn't come off. It did not come off. There we go. That came off. Good. Put on my needle head. I label this as well since I have 2. Luckily for me, heparin and Demerol are different colors. Put everything back. That. Okay. All right. Now that I have my medications drawn up, I go into my third and final check. So I'd recheck my MAR again, making sure I have everything right. Go through my 5 rights one more time. Right patient, see how I'm right medication, both of them, heparin and Demerol. right dose. So I did the doses already. I calculated them out, but I'll check them again. Right route. Heparin is sub-Q. And Demerol is intramuscular. And then right time. And then this is the time that they're supposed to be given. So take these off. A little bit more hand hygiene. All right, Tom. I have my medications ready. Now what we're gonna do is I'm just gonna get the landmarks for each of your sites for the intramuscular injection, and then we'll do that. So I'll go through. We'll start. The first one is gonna be your shoulder. So you'd start at the acromion process, which is that your shoulder blade. You find that, and once you have that, 2 to 3 fingers. I'll use 3, and then you'd find where the shoulder ends, where it comes to its natural slope, and then you get in the middle of that. So probably right about there if I was to do delt. Okay, that's the deltoid. I'll do vastus lateralis since you're already on your back, and then I'll have you go over it, right? So for the vastus lateralis, you'd find the greater trochanter, which is the joint of your femur, and then your knee. Right about here. Okay. And then yeah, okay. And then you'd put. Sorry, that's what you do for the other one. Then you'd knee, greater trochanter. You'd spread out your hands just so, and then you'd find the middle of the middle between these 2 points. So that's the middle. I'd go in the middle of there, and that would be the vastus lateralis. And then I'm gonna have you just roll over just on your side, Siham. And we're gonna get a final one, which is the ventrogluteal. You'd find that greater trochanter again. I'd have to do it on this side since it's that way, but you'd find greater trochanter, which I just had, which is right there. You'd have your thumb towards the umbilicus, and then your other 4 fingers extended parallel with the spine. Once you have that, and then the site would be just in between your 2 fingers. You have a little room in between that to play with, but mostly just right there. And that would be the 3 sites. I already have you here, so I'm just going to do it in a ventrogluteal, all right? So I've identified my site. I'm going to do it one more time just so I make sure that I have it. Identified my site. I'm going to get my IM, which is my 3mm syringe, and then I'm going to also do, before I start, I'm going to clean off my site. Obviously, for the demonstration, she's wearing clothes, but it would be exposed. I'd make sure to clean off the entire area, and then I'd go back, make sure my site is clearly identified. Right there. I'd do that with this finger. That way, I get out my needle. For the demonstration, the cap is going to be on, but it would be obviously off for administering. And then this is intramuscular, so I'm going to do Z-track. So I have the exact spot that I need. I am going to displace the skin with my non-dominant hand. For intramuscular, I'm going to be going in a 90-degree angle, so I'd go in fairly quickly. I'd hold the medication with my non-dominant hand. A little bit harder when it's not actually in the skin, but I'd plunge it with my dominant hand. I'd re-grab it with my non-dominant, with my dominant. I'd let go with my non-dominant. Take it out as fast as I had administered it, and then I'd replace that skin that I displaced earlier. This would go in the sharps, which is over there. I'm going to take all those over at one time. That's done there. All right, Siham, if you could just come back over for me. Sorry. Last thing I need to do, I'd get some gauze out, just in case it was bleeding. We're going to be giving heparin. I did the intramuscular first, but we'd be giving heparin, which is a blood thinner, so there'd probably be expected blood pooling. Clean it. Make sure that that's on there, and then I have some tape. I put that on there, and then I'd make sure that that's good. All right, but the instance of the demonstration, there's no blood. And finally, how was that? Did that feel all right?
Yeah, that feels much better.
Good. And then last but not least, I don't think I need to, but I'm going to change clothes anyways. Get a little bit of sweat. All right, and then finally we're going to do our heparin, which is our subcutaneous. So subcutaneous is a lot easier. The site we're going to be using is going to be the abdomen. For the abdomen, you just have to get the adipose tissue within 2 inches of the umbilicus for an adult. So umbilicus is right there. I can feel the indent, and then anywhere around here would be fine. So I'd find my spot. I'm gonna leave the tip on, but I'd come in at a 45-degree angle for subcutaneous. I'd go in as fast as I would for intramuscular. I'd push the plunger as fast as I would for intramuscular fairly quickly, and then I'd take it out just as fast. And then I'd also have my gauze, and I put the gauze on there. I forgot, but I'd make sure to do just as I had done for my intramuscular. I'd use a alcohol pad to prep the site before I administer the medication. And then after the medication was administered, I'd make sure that I had gauze and some tape or a bandage of some kind to make sure to stop the bleeding. And then I get all my trash up. I take all my needles and my cannulas to the sharps container. Make sure my patient is good. How you feeling, Siham?
Great.
Good. Those are your medications. You are good to go. I am going to lower your bed down again. Let me know what's comfortable and what isn't. Oops, sorry. There's so many buttons on this thing, I barely know what to do. Comfortable?
Yep.
Good. I'm gonna give you your call light. Let me know if you need anything, all right?
Okay.
I'm just gonna go document, but let me know if you need anything else, okay? I make sure the bed is low and locked. I take my stuff with me as I leave, including my computer. And then I go document, med.
No, but